Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you'd like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I'm very pleased to welcome Dr. Edward Cruz out of Windsor, Canada. Dr. Cruz is a certified nurse educator. He's a fellow of the Canadian Academy of Nursing. He's an internationally educated nurse from the Philippines, and he's an ATLAS.ti professional trainer. So, welcome, welcome, welcome to Nurses Talking, Edward.
Thank you very much, Dale. It's really such a great honor to be with you. We've been planning to do this for quite some time now, and finally we get the chance to do it. So I'm very pleased. And thank you for your patience with me.
This is what nursing is, though, It's very, as exciting and rewarding as it is very unpredictable. So there you go. We're just falling into the pattern.
Yeah.
Anyway, what brought you into nursing?
What brought me into nursing? That's a very good question. Growing up, I've heard of my two aunts who were nurses, and I think they indirectly influenced my desire to become a nurse. And
Mm,
then growing up, my dad, who's a physician, would always have me and my siblings go with him, went with him to the hospital when he did his rounds. Of course, we had to stay in the either in the cafeteria or in his office. But the interaction with other healthcare professionals at that time must have molded my mind into becoming a nurse. However, in
Yeah.
saying that, I wasn't always a nurse.
Okay.
In my past life, I actually became a dentist. Back in the
Uh-huh.
Philippines, we parents usually pay for their children's education to university. And so my parents suggested we don't have a dentist in the family. Why don't you be the dentist? And so, okay. And so I went I went ahead and decided to go into dental school at my parents' suggestion. And although I was disappointed, I kind of liked dentistry until an opportunity came where I finally submitted my application for permanent residence to Canada. And then I
Uh-huh.
was doing my research. And then I realized, becoming a dentist in Canada is almost next to impossible. Why don't I reinvent myself and do something that I also like to do? And I've always wanted to be a nurse. And at that time in the Philippines, there was there was a huge increase in the enrollment numbers in nursing schools, and there were physicians and other healthcare providers getting into nursing school because of the huge demand in the US. Although I had my eyes set on coming to Canada. And so
Uh-huh.
I enrolled in nursing school, attended classes at night or my clinicals on weekends, and that went on for about 2.5 or 3 years. I can't recall exactly. And then by the time I completed my nursing program, it was just about time for me to go to Canada. Because when they approve your permanent residence visa, they set a deadline that you should land in Canada by this date. And
Yeah.
so soon after that, I landed in Canada, and the rest was history.
So now that intrigues me because here you're a dentist. That's really an autonomous kind of profession. Then you become a nurse, and you don't even have the opportunity to really work as a nurse in the Philippines
I
before
never
you
worked.
change cultures
I'm
and
not even I'm not even licensed in the Philippines.
and there you go. So what were the challenges for you?
The challenges for me was early on. I knew when I finally moved to Canada, of course I had to submit my registration application to the regulatory body, and I knew visiting hospitals um, and hearing things from my aunts who are nurses. I realized that the way we do nursing back home may not necessarily be the same to how Canadian nurses
Yes.
enact the profession. We may have studied from the same body of knowledge, but the way we do nursing from one jurisdiction to another, and as I
Yeah.
learned subsequently over the course of my career, even across Canada, the way
Yeah.
we do nursing from one province to another may be slightly different. And it's the same for
Yes.
Canadian nurses going to the US.
Mm-hmm. Yeah. Yeah. Yeah.
And
Yeah.
so with that realization in mind, without even being required by the regulatory body, I decided to go back to school and attended a 1 year bridging program.
Mm-hmm.
And that for me was the best decision I've ever made because it helped me understand the context of the Canadian healthcare system and how Canadian nurses use their knowledge to care for patients.
Yeah, yeah, yeah. That's a very, very important point. And that really is one of the things that prompted me or piqued my interest in speaking to nurses on a global scale. Because like you, I've had the opportunity to work in several countries, and that is really one of the things that first you hits you almost immediately that
Mhm.
the differences, and as you quite rightly say, we study from the same body of knowledge, but the scope of practice, what is expected of you, how you're allowed to function, completely different sometimes.
Absolutely.
Yeah,
And I thought that was very important in order to provide safe and efficient care to our patients.
yeah, yeah, yeah. So currently, you do what?
Currently, I'm an associate professor, and very recently, as of July, I assumed the role of associate dean for undergraduate for programs at the Faculty of Nursing here at the University of Windsor.
Hmm. Awesome. So, sorry. You're an educator. You're also a professional trainer for the software ATLAS.ti. First of
Yes.
all, before I even go any further, what is ATLAS.ti?
ATLAS.ti is a qualitative data analysis software that helps researcher manage their qualitative data, although recently and personally I've used it to do literature reviews, that kind of stuff. It's very intuitive. If I were to compare it with another qualitative data analysis software, I'll have this example. When I was just beginning to have a better appreciation of qualitative data analysis softwares, I
Uh-huh.
enrolled I enrolled in a 3 day workshop to learn another kind of software. And I completed that workshop and I was just as confused by the time the training ended. And then became an opportunity for me to attend a half-day session on ATLAS.ti at a conference in Alberta. That half-day workshop, which was actually 3 hours, was more impactful for me than the 3 day workshop. And so that's when I started to take interest with ATLAS.ti and I started using it in my projects. And then I learned about the certification program and so I did some of the activities that they required at that time. And fortunately, I've been awarded the ATLAS.ti trainer program
Trainer
certificate.
program. So, I, I love that about the 3 days and the 3 hours. I really do. So often that kind of thing comes up, you know.
Yeah.
Um, it really is true. I can identify. But as an educator, how do you see then technology influencing the way we educate nurses in the next 5, 10 years or so?
I think there's been a huge demand for educators to become technologically savvy if we want to continue to engage our younger generation of future nurses, because this is the way they learn.
Yes.
And sometimes even redefining what constitutes academic dishonesty. Uh, because with the, for example, with the use of AI, we find that there are students who are very adept at using AI. But then,
Mhm.
how can we encourage them to use AI responsibly? Um, by letting maybe we need to remind them that AI may be a good source to help you create an outline for an assignment as opposed to having to use it to write an assignment for you, especially
Mhm.
when it, especially I'm finding that more and more recent graduates are desiring to get into master's programs, and if we are not able to develop the writing skills without the use of AI, or without the judicious use of AI, we may not be helping them. And so these are probably things that we need to start embracing. Incorporating elements of AI in our assignments may be the way to go, so that they are aware that we too know how to use AI,
Mhm.
and that we are using it responsibly. And we do tell our students, we sometimes use AI to, if we're running out of ideas. For example,
Mhm.
I've heard of colleagues who would ask AI, write me an outline about this topic.
Yeah.
And that's okay. As opposed to write me an
Right to
assignment.
the topic. Well
These
said.
these these are the parameters, and this is the marking rubric.
Yes, I fully understand that because it is very tempting to have this capability right at your fingertips and then not be able to use it.
Absolutely. And
And
and and I think it's a disservice not to take advantage of what it can do
yes.
to help enhance
Hmm.
student learning and ultimately safe patient care.
Hmm. Hmm. Exactly. And we do have to recognize that it has the capability of expanding our vision. In that, for example, you just talked about someone asking for the AI to write an outline for a particular thing. And I can see that use. I can see that use translating even into the way we do care. My favorite example that I've been using recently is especially and probably because I don't know, I think about falls, but especially in, let us say, falls care of someone who's a frequent faller. And I can easily ask AI, look, I have done all of these interventions. I have this person with this, and this. Suggest an intervention for me.
Yeah, absolutely. And I think that's a legitimate use of AI.
I think
It it
so.
o- it offers you opportunities to reflect on potential interventions, and then you still, as the healthcare provider, have to make the decision as to
Yeah.
what is most appropriate given your patient's circumstances.
Yes.
It's
Yes.
still
Because
it's
this is
still
still an individual.
client-centered care.
Hmm. It's a still an individual, but absolutely, I think so. I think so. So now, as a professor, so back as an educator again, are you finding one of my struggles as a young nurse was balancing um, theory and clinical practice. So are you finding that students are having a lot of trouble with that? And how do you advise them, instruct them to manage to merge these two things together? Because very often theory and practice are like sometimes miles apart.
That's a very good question, and I think in our curriculum here at the Faculty of Nursing, and I cannot take credit for this. It was actually my predecessor, Dr. Susan Fox, as well as my other colleague, Dr. Kathy Paff, who were instrumental in redesigning our curriculum. And so by redesigning our curriculum, they were able to weave and thread 13 concepts based on our conceptualization of the nursing meta paradigm across the 4 years of our program. And so the theory that we teach in the classroom are closely interwoven into our experiential learning lab for that semester when they learn that content. And those content that those concepts are then applied in the clinical setting.
Uh-huh.
We start our students doing clinical in year one. And so the information, for example, that they learn throughout the fall and winter semester, they apply it in the winter semester clinical, and then consolidated practice at the start of the spring semester.
Mm-hmm.
So the feedback has been very positive. I had the great pleasure of joining the dean in March, along with my predecessor, Dr. Fox, in doing a focus group with our students across all 4 years. And without us prompting them, they said that they can see the alignment between what they were learning in the classroom, into the lab, and into their clinical practice. And I remember seeing Dr. Fox's face. Her face was glowing in pride, um, because that's her baby. This
Mm-hmm.
curriculum is her
Mm-hmm.
baby, and hearing that directly from students without even prompting them
Mm-hmm.
was such a great reward.
Yeah, that must be hugely gratifying. I can see that. And especially as we all know that that is where a lot of new nurses flounder.
Mhm.
So that's awesome. That truly is awesome. I love it. I love it. I love it. I was reading something the other day, and this comes back a bit to a little bit of technology, and um I can't give you all details of what it is because I briefly read it during a few minutes that I had. But I know in South Korea, they are using apparently robotics very assertively. I don't even want to say aggressively, but assertively in long-term care, using robotics to do many things that are hands-on, that we consider to be hands-on right now. And so I'm wondering, do you see us doing that?
I think at some point we will get there. How soon, I'm not quite sure. I think traditionally Canada has been slow in adapting and adopting these kinds
Yeah.
of things. Um, I'm not quite sure in the US. I think you're much faster in embracing these kinds of technologies than we do. I do know that there are some bigger hospitals, for example, in the Greater Toronto area, that are starting to use robotics within the operating room.
Uh-huh.
And 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 I can see the potential for that to promote patient safety, especially in, like what you said, in long-term care.
Mm-hmm. Mm-hmm. I think my personal opinion is that it's going to come upon us much more quickly than we're ready for it.
Yeah. And I think that's the challenging part, because we want to make sure that our colleagues are well prepared to use it to their advantage so that they can again provide safe care.
Yeah.
It's an adjunct. I think that these equipment are important tools, but they cannot replace the care that nurses provide to patients.
They cannot replace the care. They cannot replace the care.
The
Not in the
human
way.
the human
Exactly.
to human contact is what uh, patients require as part of their healing journey.
Mm-hmm. 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 Yeah. I have been asking for these words, Edward. I've been asking people if they can describe what they see as the most important quality of a nurse. What would that, in one word, what would that word be?
The most important quality of a nurse, I think, a listener.
Listener. Okay. Yes.
And the reason why I say listener is because if we listen to our patients, we will understand what their needs are. If we listen to our colleagues, we will understand what their perspectives are with regard to the care that we provide to our patients, and that promotes um, teamwork and
Mm-hmm.
ultimately patient or client-centered care.
Yeah. Yeah.
Care, I know we always say that nursing is caring, but if I reflect on that further, it's not only nurses who provide care.
Right. Right.
Social workers provide care. Physiotherapists provide care, maybe in a different way and context, but we don't necessarily have the monopoly of care.
Yeah, yeah, and just as you were saying that, I'm thinking, just as we say it takes a village to raise a child, it takes a village to care for a person.
Absolutely.
Yeah, yeah. When I started asking for these words, it was for a totally different reason. It was because I thought I was able to recognize nurses without being told they're nurses. And as I started asking for these words, and people come up with these words that I hadn't thought of, and I begin to see nursing unfolding, the whole thing unfolding in so many different perspectives that, I had no idea that asking that question would go in that direction. But I get so many words that when you think about each one of them, they all apply. They all apply. So a lot of what we talk about, especially post-COVID, we have a heightened sense of awareness of burnout. And so I've been asking people, what does self-care mean to you, and what do you do?
For me personally, I try to disconnect from my gadgets, from my work-related gadgets after 4:30 p.m.
Mm-hmm.
And in many instances, I've been successful in doing that.
Uh-huh.
So there's that caveat. In many
Yes.
instances, it doesn't always work if there is a deadline to submit a grant
Yeah.
or a very important student issue requiring immediate attention, then
Yes.
I need to engage. But
Mm-hmm.
otherwise, I try to disengage after 4:30, and most weekends I don't do stuff related to work. And whenever I'm out of office, when I have to be out of office for an extended period of time, I in my auto reply I would say, I will return on this date. If your message is important, is requires immediate attention, contact one of my colleagues. If not,
Mm-hmm.
please resend it after I return.
Yeah.
Because I'm thinking if I'll be away for about a month on vacation and they require immediate attention, then I can't
Someone.
help them. Someone will help them at some point. But for me to go when I to go back to work and then have a gazillion emails in your inbox and going through each one of them,
Mm-hmm.
if it's really important, I'm assuming that they will resend it.
Yes. Exactly.
Otherwise, I don't have to go back to them. I don't feel obliged to go back to them anymore.
Yes. 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 Healthy boundaries.
Yes.
Healthy boundaries. I have one more question. Listening to you and looking at what you have done over the years, you have worn a lot of hats. So, what would you say is your greatest achievement so far? What are you most proud of?
I think being in this role here at the University of Windsor has been the greatest accomplishment I've had to date, only because since I, I've never accomplished so much within a short period of time that I have here at the University of Windsor. And
Mhm.
even the idea of becoming my 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 pre-migration hope was to get back into the academy, and
Mhm.
that I achieved when I finally got this job at the University of Windsor. But then me becoming an associate dean was something that I never dreamed of. And and it's a product of the trust that my colleagues have placed in me, and I have this, I call them enablers, and I call them enablers in a very positive way. I have these enablers who have been very supportive of me and who've allowed me to grow and take things to places that I never would have thought of, like working in projects and so many other things. I think this is the I wouldn't mind retiring now because I think I've reached my pre-migration goal. It took me quite some time to get there, maybe about 15 years since I moved to Canada in 2003, but it was all worth it.
Very positively and very kindly call them enablers. But when it's very it says something about you though. When you present yourself and work yourself in such a way that other people recognize qualities in you that help to push you forward. So it says something about you too.
Thank you.
Yeah. Edward, thank you so very much for this conversation. I've truly appreciated. I've enjoyed talking to you.
I enjoyed this conversation. It afforded me additional opportunities to self-reflect early in the day, and I really love it. Thank you. Thank you, Dale.
Thank you so very much. It's been my pleasure.